an ultimate global podcast. Hello, and welcome to our special weekly podcast on trending international and social affairs. You're listening to Saurabh Kora and George Mavros from Sydney.
So, welcome to another exciting episode of Ultimate Global Podcast. We are coming closer and closer to our first year anniversary, and so is our diversity also growing. We have had a lot of episodes on sales recently, and this time we are trying to have something different on healthcare and trying to dig deeper into this digital marketing in healthcare and how it can improve the patient engagement. We have got Dr. Maida Affan. She's the co-founder of Xeven Health. Xeven Health is a strategic business partner in healthcare. She's based in Canada. Now she's joining us from the Saudi. So welcome to this episode, Dr. Mehta.
Well, thank you, Saurabh. Thank you, George, and for giving me the opportunity. Congratulations on 1 year of the Ultimate Global Podcast. You know, being a podcast host myself, I know how much energy and consistency and effort it takes. So commendable effort.
Thank you so much, Doctor. Thank you so much, Doctor. To begin with today's discussion, I would like to ask you this question of how do you think digital marketing has transformed healthcare sector as a whole? I do a lot of digital marketing. I've done some sort of digital marketing at startups from a tech sales point of view, but would be keen to know from a healthcare point of view, what do you feel are the major trends in digital marketing? And then we can have some follow-up discussion with George as well.
So I think we should turn the question around, Saurabh. It's not how much digital marketing has transformed the healthcare sector. It's really about the healthcare consumers and how they're driving the digital transformation in healthcare, everything from tech all the way to marketing. Now, historically speaking, healthcare has always kind of been late to the game. And what I mean by that is that, you know how technology, other industries are benefiting from technology. They're leveraging the power of technology and they're benefiting greatly from it. And more so after COVID and the pandemic, healthcare, of course, because it took the biggest blow and it was the main sector that was sort of involved and hit by the pandemic, it's just pushed everyone towards digitization, right? So everything from patient care to provider care to the way that the patients and providers interact with each other, but then also the different stakeholders in healthcare. Having said that, healthcare marketing and communications has also changed. The marketing landscape over the last 10 years, but more so after the pandemic, has really become digital first. And the sooner healthcare organizations realize this, the better. So I'm just going to elaborate a little bit on that. When I was, I practiced as a clinician, as a general practitioner for briefly about 2 years after I graduated, and I was on parental leave. And as most doctors, they can't stay idle for too long, and so I was just looking to stay busy, and I wanted to, just maintain my sanity, in other words, by keeping busy and staying productive. So I got a job with a US-based telemedicine company. And this is 7 years ago. This is before digital health was booming in the market. This is before telemedicine was actually a new normal way of communicating. And with them, I started off as a clinical content strategist, but then that role quickly expanded into digital marketing, into product launches, into communications. And so that is where I found that, you know what, I think I'm pretty good at this. I think I can do this as well. Because, even before medicine, before my creativity, went to die because of all the textbooks and everything, I've always been a storyteller since childhood, ever since I can remember. So this was creativity combined with my clinical knowledge. And so I really found that this was a place where I could add the most value. And long story short, it was over the years, I've just been able to create a niche for myself in healthcare marketing and communications. But now we know, as especially after the pandemic and when health tech tools are increasingly hitting the market, there is this conversation among industry experts that product design and development and other processes and decision making should be clinician guided and should be with the collaboration of clinicians. That is the only way that we can make patient centric solutions, and that is the only way that we can reach our patients better, is when you involve somebody who's from the system, understands the system, understands the products, understands the patient provider journey, and understands the psychology of the patients, right? Because that is what we're focusing on marketing nowadays. It's the behavior, it's the consumer behavior. So there's a term sort of called consumerization of healthcare. And what that means is, when I say that the patients are in the driving seat, it is because they have become more empowered, they've become more in control, and they are the ones that want to make decisions pertaining to their healthcare, because they have this device, in their hand 24/7, and they know that with a click of a button, if they want to order food, they can order food. If they want to watch their favorite movie, they can watch their favorite movie in the palm of their own hand, right? If they want to go shopping, they can do it without leaving their house. And why can't we do that with healthcare? Why can't we make the experience just as seamless with healthcare? Now, in the marketing context, it's about meeting patients where they are, right? So we know that the patients are online. We know that the patients are using social media, and we know that the patient's attention span has also reduced by a lot. So we need to, as healthcare marketers and communications experts, we need to be mindful of their behavior. We need to be mindful of their psychology and cater to all these factors and more, to be able to reach them in a more engaging manner, so to speak.
Yep. I think one of the interesting points that you just raised was understanding the consumer behavior or psychology. I really feel that it's very important to understand that thing in all the industries. How do you generally visualize that for the healthcare sector in general?
No, great question. So, when we talk about the psychology of patients, it's really, we have to understand that they're coming from an already maybe stressful place, because they're the ones who are suffering from an illness or a disease, or some sort of problem that they want a solution to. Unfortunately, we're still struggling in terms of digital health. We're still struggling with the basics, right? So we want provider access on time. We want to be able to get our medicines on time. We want to be informed, and we want to be involved in the decision making with the healthcare professional. Um, and then let even beyond that, if we talk about grassroots level sort of the problems that we have surrounding health inequities, right? So there's a difference between health equality and health inequity. So health equality is the assumption that everyone is getting the same, or everyone has access to the same quality of care. And then health equity is that everyone is getting the same equity of care, or the same quality, or has access to the same quality of care. And what I mean by that is, we have to keep in mind, we can assume that everyone has an internet connection. We can assume that everyone has a smartphone. We can assume that everyone knows how to use the smartphone. But the reality is not as such, right? There are different patient cohorts. For instance, studies show that the older patient cohort, they're not as tech savvy, they're not digital natives, and so they usually require some sort of assistance. Although now they can use basic applications like WhatsApp and like other sort of basic mobile applications. But then that is where we have to come in and understand and ask them, and make these solutions and communication materials and marketing materials really user intuitive, really easy to understand, and help the patient get the awareness of their illness, but then also provide means of using this information to make shared decisions with their clinician, for example, and then more informed decisions about their health, right? So it's all integrated. We have to stop working in silos. And I think a big conversation in healthcare right now is about the healthcare ecosystem. And the health communications and healthcare marketing can really help, bridge a gap in that area. I was reading a survey the other day, in which it said that there was a survey of healthcare executives in a hospital, and they said the biggest gap that they see, that that impacts patient care or patient outcomes is the health communication gap between the provider and the patients, even tops supply chain optimization. So that just goes to show that there's something wrong. Where either I'm just saying that if we can have a mobile app to consult with a doctor online, why aren't we using technology? Why aren't we using innovative technologies for better communication to reach the patients where they are? A couple of days ago, it was really interesting because I often talk about social media, and so social media or marketing is often taken as you put on posts, and social media is for healthcare. People don't take it seriously. But I came across a research where it was one of the first decentralized clinical trials. So decentralized means that you're not dependent on a certain location, but you can reach the patients where they are. Whereas typically a clinical trial consists of patients coming to a certain location, traveling all that time, having like control groups and everything. But this was one of the first decentralized clinical trials, which means that the surveys and the patient monitoring was done remotely and was done virtually using technology. So, but where did they get those customers, or where did they get those patients for the clinical trials? From social media. And I actually wrote a post on that on LinkedIn as well, that this is how we can leverage technology. This is how we can use omni-channel marketing for healthcare processes, such as clinical trials, such as patient engagement, such as better patient-provider communication. I can go on, but I'll let you.
I guess we can also look at from a consumer's point of view, or from the other side of other point of view as well. And moving to George now, as to how do you think, George, the healthcare kind of has changed over the last 20, 30 years in Australia, because you have been here in Australia. So from a patient's point of view or consumer's point of view, how do you think, as Dr. Mehta is pointing out, that if you can have that on your mobile, on your fingertips, the life can become very easy for patients when they are interacting with the providers of the hospitals, isn't it?
Yeah, I think there's a couple of things here, though. Those that can use the mobile or the internet or the computer, it's fantastic. The age in Australia, our population is aging. There's a heck of a lot of people that are scared by technology, and anything I do and anything I get, I don't know if it's a scam anymore. So there's all that fear around it. And that's a topic within a topic, because I think the internet and a lot of the internet providers have a lot to answer for to tighten up the security and therefore credibility of social media, of internet use, of your phone. There's many a person now that won't respond to a text message that comes on their phone because we just really don't know who's doing what. On the other side of the coin, I think one of the great advancements, and certainly this has been a benefit to me in the last year, I had occasion that I had a weird reaction to a tablet and ended up in hospital, and then had to get scans done, and then had to get information, and then had to talk to my doctor, and then had to do this, and then had to do that. But it was all coming through on my app on my phone. And so when I did go to the doctor, I had my scans available. He had my information. When we went to move one of my clients, we moved him from one location to another location. All of that was sent through in a heartbeat. So that's been a great benefit. My concern is yes, it's accessible, but is it applicable to the aging population that we have? And that's not just in Australia, that's got to be in other countries around the world also. The marketing side of it, and it's interesting that we're talking about the marketing being consumer driven and all of that. Theoretically, marketing's always supposed to be consumer driven. Theoretically, we're supposed to be doing marketing and finding out what the consumer wants and then supply. I think Dr. Affan,
Yeah.
the difference is now the people have the ability to tell you that you're wrong or tell you that you're right a lot quicker. And so we're actually getting a truer representation, not some peanut that's sitting in an office on $200,000 a year and they decide what somebody wanted. There's actually I think we're getting a richer and a better feedback from the consumer.
Absolutely. I think that you've touched on an excellent point that, marketing is always theoretically been driven by the consumer. The only problem has been that patients have never been treated as consumers. And it's high time that healthcare organizations look at patients and see patients as consumers. Now, then people, there's an argument there that, are we commodifying healthcare? Do we treat healthcare as a commodity? Well, it's not all of it is transactional, no. But there, of course, it's based on relationship building. But the fact of the matter remains that yes, patients have more power, patients have more knowledge, patients have more awareness, and patients are going to hold you accountable for that. And patients would like to know and be more informed and make shared decisions with their clinicians. So, yes, I always say that healthcare is a very unique industry because it's based on a framework of ethics and patient privacy, and there are regulations and compliance and guidelines that we have to follow. And so, but even if, while, being within that regulatory framework, I still think that you can, if nothing else, you can be the source of information. You can be that trustable source of information for your patients, if nothing else. And so the focus should be integrated. The focus should be a holistic sort of approach where you are guiding the patient from the first sort of step all the way through the patient journey. And this is why other industries are doing so well, because they're incentivizing their offerings. And I think this is a huge gap in the healthcare industry, that we have to learn how to incentivize healthcare for the patients. Now, not necessarily, I'm not talking about monetary or economic, compensations, but maybe something like so for instance, in developing countries, I know that I have a lot of colleagues and I'm in those conversation spaces. The maternal health, for instance, is poor. The maternal morbidity and the maternal mortality rate and the infant mortality and morbidity rate is really high in developing countries. So what they're doing now to make sure that pregnant women are booking themselves into or checking into a maternal facility is that they give them a certain amount of compensation or a reward, so to speak, that book yourself, go to your antenatal checkups, take your antenatal vitamins, and go to your follow-up postnatal care, right? But they're incentivizing it in a way that makes sense to them, to that particular audience. For people who are using digital technology, I think we can do the same. Other industries are doing it, right? I mean, I'm sure you're like probably a loyal member of some community or Starbucks or something, and look at how they incentivize their offerings. I think maybe we could find creative ways to engage our patients that way. Maybe we could give them like a free online consultation for a certain amount of points that they gather. Or I don't know. I'm just saying some sort of reward system that keep them engaged, and this is where we can learn from other industries outside of healthcare. This is what patient engagement is, right?
I think one of the areas that can be further developed, and I'm starting to see it happen more and more now, but I don't feel well. Okay. Oh my gosh, it's 5:30. I've got to wait. The doctor's surgery doesn't open till 8:30 tomorrow, so I don't know if I can even get in to see my doctor at 8:30. However, I've got a sore back and I want to go and see my chiropractor, and I can hook onto this and I can actually book myself in and I can see when they're available right through. I can plan my day for tomorrow with my chiropractor, with my remedial massage, with this. And I think those are the areas within health that I think we can still do better in.
Yeah.
I waited just on a week and a half to get a specialist to actually be able to speak to them, to be able to get an appointment. And you already know if it's a specialist, that's 3 weeks out. So now I'm at 4.5. Like, God forbid if you're actually dying and you had a 24-hour disease, right? We'll get to you within a week. Now, so I think now I don't think you have to give me incentive for that. All I think you have to do is let me know. Sarab doesn't have that service. That doctor does have that service, and eventually I say, you know what? I'll go that way. And that's I've seen a lot of that happening. I use the example of the chiropractor because my chiropractor is about 30 minutes away from me, and he's had that system in for probably over 1.5 years now, where you can literally go in and book. You know exactly when he's available all the way through, and all the practitioners in that clinic. They've got masseuses, they've got the chiropractor, they've got acupuncture, they've got all sorts of things. You can actually go in by category and say, right, I want to see them first, then there, then there. So I think that's another area that can be great help. Because I remember when my mum was alive and she was getting frail at home before we'd moved her into a home. And did you get onto the doctor today? Oh, no, I rang up and it was engaged, and then I got distracted, and then this happened, and then that happened, and I couldn't sit there any longer.
No, I think what you're referring to, George, is because of the staffing crisis as well, and I think that's a global problem because there's a shortage. There's a shortage of doctors. There are bottlenecks that are sort of piling up, and this is impacting patient care, right? Which is resulting into longer waiting times and just people sort of maybe brushing their, just like, oh, it's so long. Let's just forget it. Let's just brush it under the carpet. Let's just do home remedies or whatever, and it often ends up being worse, right? So interestingly, I was recording one of my episodes just yesterday with a person in Canada, and they've come up with a really innovative solution. So they are helping the staffing crisis in Canada, and they're using technology. They've made a portal, a job matching portal for healthcare. To support the staffing crisis there, because I was reading an article the other day, and I live in Ontario, so there are a lot of hospitals in Ontario that are closing down temporarily because their ERs, emergency rooms, and their ICUs are lacking nurses. They have there's a shortage of nursing staff. So I think again it's a plethora of challenges, of problems. Having said that, it can be overwhelming at times, when we talk about healthcare and the problems that it's facing. But again, as they say, a problem is always an opportunity to make it better. So, we're getting there. We're trying to move the needle forward, and hopefully we'll see some advancements in that.
Yeah. Sarab, there's something that's near and dear to my heart at the moment, because, as you know, I'm part of the Ross Hutchison Foundation, which is a charity that I'm now CEO of. Now, Ross suffers from diabetes, and I've been around various relatives over the years that suffer from diabetes. Ross has a little unit on his arm now. We're sitting there having a meeting. His phone goes off, tells him that his sugar levels are up or down, and can even indicate to him how many units he has to self-medicate with.
Yeah.
Now, for somebody suffering from diabetes, I've had friends over the years who didn't do their check quick enough. That by the time they found out they were in trouble, they'd passed out. That is a huge advancement in technology, and that's where patient-centric and technology combinations is to me, it's just a fantastic setup. Because I've literally been with him and he's gone, oh no, that didn't work, hang on, and it sends another message to him. Brilliant.
Yeah, and just to sort of expand on that and add the communications part to it, it's so important to provide awareness about these technologies to patients so they know how to use them. And this is actually the gap that I was referring to earlier. But Saurabh, go ahead. I think you have a question that you were saying.
Yes, join us anytime, Sarah.
Thank you so much. No, I think we have been touching upon some really good points, such as incentives, understaffing, booking system. Another thing that we definitely should talk about here. I don't know. I know this topic is this podcast is more inclined towards marketing, but I think affordable healthcare is something very important topic to discuss upon. In developed countries, we don't realize this because we have a social security system in place where governments sponsor the healthcare, governments take
Yeah,
care of your health after a certain age or maybe throughout your lifetime. This is not the same case in developing countries. Most of the South Asian countries, African countries, they don't have free healthcare. So when we are talking about inculcating these technologies, I would like to ask you, Dr. Maida, what are the players which really need to play a major role to make sure that the technologies are adopted pretty well, but it is also
right.
affordable for the audience and accessible to them? And I
Yeah.
think government, public health players, entrepreneurs can really play a major role in that, isn't it?
No, excellent question. So it's really good. I like the direction that this conversation is headed in because, like I said, we cannot work in silos, so everything is interconnected. When we talk about developing countries, most of the up to 70% of the population reside in rural areas, right? And so I was having a conversation with a friend the other day, and I was like, well, if we go to the rural area, first of all, most of them live below the poverty line. They're not as educated as you'd like them to be, and they're basically struggling for basic necessities such as clean drinking water, right?
Yep.
Like let's face it, they're not going to know how to, or they're not even going to care. Their healthcare is probably at the lowest, uh, down really low on their list of priorities. So what we can do is either we have to find identify the friction areas, what the gaps are. Well, they already walk 2 hours to get clean drinking water. How about we set up satellite clinics? But are they going to have enough energy left to walk all the way to the satellite clinics? No. Okay. Well, that means they need transport. Let's set up a means of transport. Okay. Let's get them like a bus or vehicles of some sort. But we don't have infrastructure. They don't have the roads. They don't have, the basic whatever. So are we going to build roads? I mean, what would make more sense, what would be most cost effective is if the telecommunication industry, for instance, comes in, gives them an internet connection. There are already local health workers there, like lady health visitors and other trusted community healthcare, practitioners who are there. Get their confidence, get them in confidence, train them, so then they can train their communities to use, these smartphones. But what we're going to do is we're going to get them, we're not only going to educate them, but we're going to distribute lightweight, simple to use mobile apps in their community. Why not? I've seen programs where they're distributing laptops to people because, for students and to help them sort of progress in entrepreneurial programs. Why can't we teach them how to use digital technology? Everyone is on TikTok, right? I mean, everyone knows how to use the TikTok. I think it's really, I don't think that there would be any resistance to change there. But the fact of the matter is, like you said, Saurabh, that healthcare is a basic human right. And it should not only be accessible for people who have the means to acquire it. It should be same. That's the principle of a health equity, that everyone should have access to the same quality of care. In developing countries, yes, we need to work on a lot of fronts. That includes outreach initiatives, that includes patient awareness, that includes, going down into the field, educating them, gaining their confidence, and then the practitioners that are in that community with whom the village or the community already has a trust established with, we have to gain them. We have to sort of work with them to inculcate, technology for their care.
Yeah, I think that's what I was trying to touch base upon because if we are talking about these technologies, if we are talking about providing healthcare on our fingertips, what if that person doesn't even know how to use a mobile phone?
Exactly.
What if
Yeah.
that person doesn't even have a mobile phone itself, right? So
Yeah.
that is what I'm saying, accessibility and affordability. Once these two A's are fulfilled, then we can talk about adaptability to the
Mhm.
technology.
Absolutely.
How do you think about this topic, George, from an Australian point of view? And I know in Australia everything is more affordable. We have a Medicare card, government sponsors. But I think we discussed about several challenges in Australian healthcare system as well, in spite of all those things already being there, right?
Yeah, look, it would be absolutely ridiculous and insulting to compare the challenges that we have in Australia in healthcare to some of the challenges in third world countries. I mean, I'm not for 1 minute suggesting they're on a par. It's not. But even in places like Australia, if you don't have private healthcare in Australia right now, and you need a knee replacement or a knee operation, you can be waiting anything up to 2 years in the public health system. Now that is partly because of the system, and it's partly because of the COVID and all of that. But the bottom line is, if you have private health care in Australia at the moment, and I injure my knee or my leg or whatever, I can pretty well get into hospital straight up. But if you're going in as a public person, you can wait and wait and wait. And I know of a couple of people that have had that very situation occur. I had somebody that needed to get some surgery done for blocked arteries, and that was not considered an urgent matter. Right now, there was ways and means that we were able to resolve that, but we had to apply some out of the box thinking, and I'll just leave it at that, to be able to get that person to be able to get into hospital in a short time, right?
Yeah.
So the problem is that we still suffer, I believe, in society of not thinking enough about the bottom 10% and thinking too much about the top 10%. And whether that's the top 10% of the 100 or the top 10% of the 50 or the top 10% of the 20, we're always trying to fix this up. It's the people right at the end of the line.
Yeah.
They're the ones in Australia, the people that are on pensions, the people that are homeless. In some ways, in Australia, you might be actually better off being homeless, because at least if you fall over in the street, the police will say, "Oh, we can't leave a body here. We've got to take them to hospital." You know.
Yeah.
But the other side of it is, and this is one of the things, Doctor, that concerns me with this whole digital thing. I know it's not medicine, but I'll give you an example. Through a chain of events, I've got an issue with my toll tag for my vehicle. You try and get on this damn phone and actually ring to speak to a human being. It's almost impossible to find a number, because we're doing digital to help you, and that's it. I'm actually I'm trying to communicate with the service provider in that. I have a record where I was on the phone for 48 minutes and still not answered. But lovely
ridiculous.
Digital stuff, and it says you can go to the web and fix this problem, but the web won't fix the problem, because the web's demanding that I do one of three things. Now, as that creeps into health, and Mrs. Brown actually wants to ask a question, but it says, "Oh no, you go to the website and those are your 3 points." That's one of my concerns. If digitalization comes into medical and health, as it has in many other avenues of our society now, people will be funneled like sheep down a certain road, and that'll be the end of us.
And this is where, well, immediately as you said that, and as you explained that, thank you for sharing that. So first of all, I always say that good reviews are good, but bad reviews are better, because it gives you the opportunity to identify those gaps and then work on them and make the patient experience better. And this is actually called, when we talk about individualized care or value-based care, this is what we're talking about. Because every patient is different. So every patient experience is going to be different. Yes, we can streamline or make the experience seamless. The major sort of touch points are the same for everyone. But when we're talking about the patient experience and what they're dealing with, we have to keep in mind their individual preferences. We have to keep in mind their individual challenges. And that comes from the social determinants, right? So that might be a language barrier, that might be an age issue, that might be a lack of awareness, that might be certain cultural values that play into the healthcare equation. So I think, yeah, George, no, you've touched upon a really important point, and this is what the conversations that we're having now in this space is: how do we provide patient-centric? Yes, but even patient-centric care has to be individualized, right, according to individual preferences, keeping in mind that everyone has that. It's a diverse population. Even within a certain population segment, there's diversity and there's individual preferences. Again, this comes to the point, this is the communication gap, right? It brings us back that this is the communication. This is why we need inclusively designed health education and health awareness material. And what I mean by inclusive is that we need to keep in mind differently abled people as well. We need to keep in mind, again, like I said, the older patient cohort. We need to keep in mind people who whose first language may not be English. And this is actually, okay, when we talk from a marketing perspective, we have to understand, or from a healthcare perspective, in health technology or healthcare digitization, there are care points, like patient appointment booking, and then you have your actual online video consultation, and you have follow-up care, and etc. In marketing and communications, you have your digital touch points that the patient starts their journey on to get their information. One of the first digital touch points is what? If you want to find something, if you want an answer to a healthcare question, where do you go first? What do you do? I'm asking you, Saurabh, what do you do? Where do you go to look for health information?
For me, it will be going on my mobile phone, searching on the
Google, right? So Google is one of the first digital points. And I have to give credit to Google that in the healthcare space, especially during COVID and post-COVID, Google actually was very mindful of the fact that Google is the first digital touch point. And what it did, it introduced some unique features. And so, for instance, if there was a clinic in your vicinity, and this was not applicable to everywhere, but I think it was applied in the US first. But what they did was that if there was a clinic or a healthcare organization in the facility, you didn't even have to go to the website. On the search engine itself, it gave you, was it wheelchair accessible? Did it have providers that spoke the same language as you? It gave you the timings, and it allowed you to book appointments. It showed you the available appointment slots on the search engine itself, like right there on the search bar. You didn't even have to go. That's how urgent, that at that time period was. But that's how Google really sort of individualized care and helped people with this accessibility that you're talking about. It made things quicker. And so now, you see this trend. It takes me to another point, but I'd like to mention it here, that you see this trend of big tech going into healthcare. And so big companies like Apple, Google, Amazon, they are acquiring these smaller healthcare companies. Well, not smaller, but relatively smaller compared to them. They're acquiring healthcare companies. Why? Because they're already using people's data. They're already using consumer data for their own products. But now they see that, well, it's profitable, which is something that I want to tell people who say that, who are hesitant, for healthcare organizations who are hesitant to adopt healthcare digitization tools, or who are hesitant to adopt health communication technology because they think it might be a cost for them. This is the point where we have to measure the cost between the patient. Are we going to risk at the cost of what? The cost of poor patient outcomes, or the cost of an ROI? And let me tell you, the research does show that if we fill that communication gap, there's actually financial benefit to it. That, studies have shown that there's a $25,000 increase per year per physician if the patient feels like they're more involved in their healthcare decision, you get up to 20% more patients. That is already an ROI, an increase in ROI, I mean. So, it's again risk versus benefit. We have to see at what cost we're giving up the other opportunity.
Absolutely. I think cost benefit analysis and also tracking these touch points, not only important in in the healthcare sector, but I think I also keep on doing that from a sales point of view. Whenever you're selling any product, you try to track those touch points so that you can see how you can enhance your communications with the customers. But I think as we're coming close to today's end of today's podcast, I would definitely like to thank Dr. Maida and George for participating and making this discussion really insightful and knowledgeable for the audience.
This is an Ultimate Global Podcast. Hello, and welcome to our special weekly podcast on trending international and social affairs. You're listening to Saurabh Kora and George Mavros from Sydney.